Ankle joints are unique. They rarely become arthritic naturally, meaning without trauma, we don't see arthritic ankles. However, if you've injured your ankle, then they often can go on to develop into ankle arthritis. And many patients are told that their only choice is to have an ankle fusion where the bones are fused together and so that eliminates the motion of the ankle, or possibly an ankle joint replacement if they're older and have low activities. We find that there's an in-between solution. We see many of these arthritic ankles and we're able to clean the ankle out of the spurs and damaged tissue and then graft those surfaces to stimulate a healing response. So the grafting of the damaged talus or the distal tibia, that part of the ankle joint, often permits people to maintain their motion and get back to the sports they love to do. So for many people over the last 30 years, we have done our BioAnkle program where we've regrown the damaged cartilage and then added lubricants and growth factors and been able to maintain these ankles and help those patients avoid ankle fusion or ankle joint replacement.